Hello, and welcome to Advanced Rehabilitation Services. My name is Maria Duran, and I am a board-certified occupational therapist. Today, we're going to be talking about the decongestive phase of lymphedema therapy. In this phase, excess accumulation of lymphatic fluid is removed from the affected area via manual lymph drainage, or MLD, which is a very gentle massage that uses various techniques for the removal of fluid from the affected area. After the fluid is canalized or shown which way to go to remove the excess fluid, the affected area is bandaged. There are a few items needed for this process. First, we make sure that the skin is moisturized. Okay, we can use a pH balanced lotion or cream, or if the skin is very dry, we can use an ointment. That is followed by stocking it. As we can see here, this is a big roll of it. It can be cut to the size needed, and it will be put on the affected area. It's almost like a sleeve. The stockinette is followed by multi-layer padding, as we can see here. After the padding, we will be using either finger bandages or toe bandages. We see here the sizes. Usually the smaller is for the toes, bigger one is for the fingers, but I have found that some people have larger toes, so I may use the finger for the toes. The padding and the toe bandages go hand in hand, as the padding helps prevent shearing from the toe bandages or finger bandages on the skin. Padding can also be used for areas such as the elbow in the crease to prevent any shearing from the rest of the materials, such as the bandages and the foam. After we have all of those down, then we use the short stretch bandages. These are called short stretch bandages because they only stretch a certain amount, unlike ACE bandages, for example, which stretch much more than these. The reason why we have all of these materials together is to contain the treated area and prevent it from refilling again, as well as canalizing the fluid out of it. I forgot to mention that prior to short stretch bandage application, there is foam. I have two types of foam here. One is the gray foam, and the other one is Comprex 2 wavy foam. The gray foam that I have here is about 1/4 inch. There are different thicknesses to the gray foam. They come in 1/2 inch, 1 inch, 2 inch. The higher the amount of thickness of the foam indicates the severity that the lymphedema is. For example, if there is a lot of fibrotic tissue, which is hardening of the skin, a thicker foam may be better to break up those very hard areas of the tissue. I'm going to show you next a different type of foam, which is also great for fibrotic tissue. This is Comprex 2 wavy foam. It has these channels that help break the fibrotic tissue on various areas treated. All the bandaging materials just shown form a soft cast on the affected area that contains the treated area but allows motion. Post-bandaging, the client is educated on decongestive exercises. These exercises are tailored to each client depending on the client's needs and affected body part or parts. Through this process, the client and family or caretaker are educated in skin, nail, and lymphedema precautions as seen on the bullet point on the screen. Once the therapy session in the clinic is finished, the client should follow up with exercises at home. The bandaging should be kept on for as long as possible or tolerated by the client for best results. If you have any questions, please feel free to contact us. I look forward to working with you on your path to better health.